Hi guys, my name is UMANG and I welcome you to live event of 2021 Live in Life. Today the topic is about pigmentation, and pigmentation is again a very broad topic. A lot of women suffer with it more than men, and we always wonder why that happens. But before I clarify like what you can do with the pigmentation, I also want to say there are many types of pigmentation. Like there are some patches you will observe. Sometimes we have it all over our face. Sometimes just the uneven skin tone that we have, we consider it as a pigmentation. So let's understand what kind of pigmentation are there. First of all, there is something called melasma. If you notice, I also have a little bit of melasma problem. Why that happens, we'll come to that later. But it happens with patches all over your cheeks, sometimes any prominent site of the face, like your cheeks or your forehead, your tip of the nose, somewhere on the bridge of the nose, or on top of your lips. So where you have those patches are melasma. Sometimes we have just the sunspots, sometimes freckles, and sometimes you have PIH, that is called post-inflammatory hyperpigmentation. Now, these are the different kind of pigmentation that we have. How do we address it one by one? I'll get it to you later. But let me just tell you, if there's one product that you could use to not get rid but prevention is better than cure, as they say, is your sunscreen. Now you must have heard, you go to a dermatologist or talk to somebody who understands skin would have said this word like a million times, but no amount of words told to you is enough, because sunscreen is the best prevention for any kind of skin problem that you may have later. So when I say sunscreen, what do I mean by sunscreen? Now, sunscreen is something which is UVA and UVB. First, understand the word UVA and UVB. What is UVA? Now, remember this A word in the end. That means aging. Aging happens because of the direct exposure to the sun. So you have long rays and short rays in the sun. When you have long rays coming, like I'm sitting here, I'm sitting by the window, all the sun is not falling on me directly but indirectly. How? Because sun, if you think, if it's not falling directly, it's not burning you, it is still burning you, it is still creating those sunspots on your face. How? The long rays that come, which you can't really see, that cause aging. So that's indirect exposure to the sun is your UVA. What is UVB? B is for burn. Now, how do you burn when you have direct exposure to the sun? So if you can actually, I mean, it might just sound like a small deal, but if you can actually prevent yourself from the sun wearing sunscreen every day, you will avoid a lot of issues. I wish I had known as a child, because I exposed myself to the sun, and till date, I mean, I do a lot of skincare products. I take care of my skin, yet I have pigmentation is because I have exposed myself as a child to the sun and never wore sunscreen. Until date, I do everything. I get clear skin, but the melasma patches somewhere where I have on top of my cheeks, they come and they go. Once you have melasma, it is like a blood pressure. It never goes away forever. It stays with you. It comes, it goes. So it goes only when you put sunscreen every day, you use certain kind of products every day. It helps you prevent that. But otherwise, once you get melasma, there's no permanent cure for it. Then you have pigmentation, like your sunspot. For that, to address that, I would suggest some peels. Like, take note of certain peels like lactic peel, glycolic peel. They really help you. So let's say you have a very sensitive skin, then glycolic peel is not for you. You get into lactic peels. Where do you get lactic peels? At a salon or at a doctor's clinic. I would prefer getting it done through a doctor, so he will be able to analyze your skin. So if you have a very sensitive, take note of the lactic peel. It'll be helpful for you. Otherwise, your skin is okay and it can take certain peels, and go for glycolic peel. What will it do? Peels that your scrubs can't, so please avoid scrubbing your face. What peels can do is it takes off the dead layer on top of the skin without putting harsh chemicals to it, in the sense it doesn't there's no abrasive nature of the skin, just scrubs have some certain scrubs. So avoid scrubbing your face. Instead of that, use a peel instead, and that will take off the dead layer and give you a fresher, cleaner skin. You've used your sunscreen, you've done your bit, and there are certain products that you can use to take care of your pigmentation or any kind of pigmentation that you may have. What you need to do is start using antioxidant based serums. So have a routine which you follow. So you don't have to get into something which is medicated products, which is prescribed by typically a doctor. Because if you go over the counter and purchase it, that may lead to post-inflammatory hyperpigmentation. So guys, be aware of the products that are sold in the market saying it is for pigmentation, because if not used correctly, they will take care of a pigmentation at that point in time, but post-inflammatory pigmentation that happens, it's very hard to get rid of. So be sure of when you use a medicated product. That's why these things that I'm talking about, sunscreen, your scrubbing, will take you a long way. You will probably not have to get into medicated cream. Now, what kind of products that you use will help you with pigmentation is your antioxidant rich serum. Wash your face with gentler face wash. Use your vitamin C is a great antioxidant. If you use your vitamin C serum in the morning, you're preventing yourself from sun damage, because the free radicals that get created through the sun, it'll control that and it'll prevent aging, and it'll also give you protection from the sun. So use your vitamin C in the morning, and in the night try and use your tretinoin based cream once in a week. Tretinoin is your retin A. If you can use that, then it will regenerate the cells in your face, and that will exfoliate the top layer of the skin naturally, and then you will wake up with a beautiful skin. So remember these things, and once you've done these things and you still feel your pigmentation is strong and very stubborn, then please take note of certain products that you can use. If it's kojic acid, or it's arbutin, or it's azelaic acid. These three, I'll repeat, it's your kojic acid, it's your azelaic, and your arbutin based creams are very helpful. You must have heard of something like hydroquinone. Now that's the gold standard for any kind of pigmentation. But again, like I said, hydroquinone has to be prescribed by a doctor, because if you do not use hydroquinone under prescription, then again, if you're not using it correctly, you will have more serious issues with your pigmentation than just getting rid of it. So make sure hydroquinone is a last resort. Go to a doctor, get a prescription of hydroquinone. But before that, something like your arbutin, kojic acid, or your azelaic are natural products which you can use without a prescription of a doctor. There are enough creams available at a chemist shop where you can buy the kojic acid based cream. How do you apply it? You need to sandwich your creams, active products, something like wash your face in the night, use your moisturizer. Once you moisturize your face, you put a layer on top of it, a layer on your skin. So once you put an active product like your kojic acid or your azelaic, it doesn't penetrate so deeply, so it doesn't affect you in a negative way, in the sense it doesn't irritate your skin. So you can apply a moisturizer, on top of it apply your kojic acid based cream or your azelaic. Don't put them together and apply either your azelaic and your kojic. Kojic is primarily for your hyperpigmentation, and your azelaic works against not just pigmentation but also for rosacea, or if you have any acne. If you have acne, a hormonal acne or a regular acne that you face with, azelaic is your best friend. I do have a YouTube channel where I make videos regarding the same, in case you want to follow, in Involve-Evolve, where I have made a video on azelaic which has become very popular with people. So in case you want to follow, you can do that as well. Other than that, so let's just recap what we need to do about our pigmentation. One is you use your sunscreen, use once in a week or once in 2 weeks, do your chemical exfoliation through a doctor's clinic. And then in the night, you can use your azelaic based cream or your kojic acid based cream, and then use it with a moisturizer, and never ever forget your sunscreen. Now, there's certain things that I like to do which I think have helped me have a clearer skin, is the home based remedies. Now, don't take home based remedies as if they are the ultimate cure, because it's more like a feel good factor than actually the results that you're getting. So home based remedies which I have enjoyed for my pigmentation melasma, that is papaya pack. So I make papaya pack at home and apply it all over the face and wash off. It does give me a clear skin. And of course, my most favorite is basin, which for centuries it's been used and still underestimated. Basin gives you a lot of clarity on the skin. So you can use your basin mixed with little bit of malai if you have dry skin. Otherwise, 2 drops of lemon if you have oily skin, with maybe a curd or something. You mix it up together with like a dash of haldi in it. The turmeric gives you clarity in the skin as well. A combination of that once in a week gives you clearer skin. So if you follow these steps, they will really take you a long way in your pigmentation. Don't go to a chemist and ask for any random cream. Like I said, stick to your kojic acid, stick to your azelaic, hydroquinone if at all, last resort, go to a doctor, get a prescription of hydroquinone and do your peels and you will be pretty much sorted. But everything takes time, everything takes commitment. Your pigmentation didn't happen overnight, the cure is also not overnight. So make sure when you are getting into some kind of a routine for your pigmentation, you need to be consistent with it. So follow these steps and see within a week or two you will have clarity in your skin. You'll start to feel better. But remember, if it is in your dermis, because what I'm talking about is epidermis, the top layer of the skin. So these are all superficial things I'm talking about. If it's gone to your dermis, don't lose heart. It's going to take a lot deeper than just the creams that I'm talking about. Then you have to go to probably, like a salon or a clinic to get the deep laser done, peels done, laser done. Then that would be the result. But that will again take a few months of practice, few months of commitment to get it done. But if you have something which is recent, which has not been there forever, all these things that I'm talking about for your epidermis will work for you. So pay attention to your skin, wear your sunscreen every day, and do the steps as followed. And do not go and prescribe anything on yourself. Otherwise, go to a doctor and get a prescription done. So that's about it for today, and we'll be soon coming out with more topics. So stay tuned. Thank you so much. Bye bye.